Each year, it is estimated that over 250,000 women in the United States will be diagnosed with breast cancer. So what can you do to lower your risk? Well, there are many risk factors we cannot change when it comes to getting breast cancer. There are things we can do to lower our risk. Today, I'm going to go through 7 things we can do to lower our risk. Number 1, exercise. It's not uncommon for patients to say, well, I clean my house or I garden, and that really doesn't get it. And what I mean by that is studies have shown that physical activity that really counts is about 30 to 60 minutes of fairly vigorous activity at least 5 to 6 days per week. Limit alcohol intake and don't smoke. When we talk about smoking and its relationship to breast cancer, we know that several things are very important. Number 1, people that abstain from smoking clearly have a lower risk of breast cancer. Number 2, people that start smoking at an earlier age and smoke a longer time have a higher risk of breast cancer versus, of course, the person that abstains. When it comes to alcohol intake, studies have shown that as little as 3 to 6 drinks a week can increase your risk of breast cancer. That's unfortunate because, a lot of people think, well, wine's healthy, I'm going to drink a glass of wine a night. But that really does have a negative impact upon a woman and her breast cancer risk. Control your weight. Unfortunately, the heavier we become, our breast cancer risk increases. And this pertains to women as we go through the change of life, so through the perimenopausal and postmenopausal periods. So after menopause, the heavier we become, the higher our breast cancer risk becomes. And so the lesson to be learned from that is to try to maintain our body weights. Give your body the nutrients it needs. Initially, some of the studies early on looking at diets high in fruit and vegetables were controversial. But then in 2010, doctors went and looked at a whole bunch of studies, and they actually found that women that did eat diets high in fruit and vegetables do have a lower risk of breast cancer, which makes sense. So what's the lesson to be learned there is eat a healthy, well-balanced diet and lower your risk of breast cancer. Avoid or limit hormone replacement therapy. So evidence has definitely shown that hormone replacement therapy is linked to breast cancer and the development of breast cancer. If people are going to choose to use hormone replacement therapy after menopause, we tell women to limit the duration of time because there is a direct correlation between how long you use it and your incidence of breast cancer. So the woman who uses it and stays on it longer, the likelihood of her getting breast cancer drastically increases. Know your family history. Most breast cancers are not part of the hereditary breast or ovarian syndromes, like we hear about on TV nowadays, the BRCA syndromes. But knowing your history is really important because maybe you are somebody that needs to be referred for testing. Either way, however, a family history does raise your risk of breast cancer. Get screened. Number 1, women should do monthly self-breast exams. We see patients who find, unfortunately, breast cancer on their own. Second, make sure you have a clinical breast exam by your doctor once a year. And then third, screening mammography. Screening mammography has been proven to reduce death from breast cancer. We tell women to start at age 40. Women seem to think there's a magic number when to stop. We tell women age 74 or 75, if you're still very healthy, 74 or 75-year-old, then by all indications today, those women need to continue with screening mammography. Thanks for joining me. I hope this information has been helpful. To learn more about cancer care at Cone Health Cancer Center, go to conehealth.com/cancer. I'm Dr. Shannon Penland.